a lovely day. When the day that lies ahead of me seems impossible to face, when someone else instead of me always seems to know the way, then I look at you and the world's alright with me. Just one look at you and I know it's gonna be a lovely day. When the day that lies ahead of me seems impossible to face, and when someone else instead of me always seems to know the way, then I look at you and the world's alright with me. I just one look at you and I know it's gonna be a lovely day. step at a time. I got your back, you got mine. One foot in front of the other. One foot in front of the other. One foot in front of the other.
This session will begin shortly. Please take your seats.
Resilient little thing, just like mama made you. No one needs to save you. Na 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 na. Wildflower in the spring, no they can't contain you. Through the cracks you break through. Na 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 na. I deserve congratulations, 'cause I came out the other side. I've been having revelations, and I'm gonna let them shine. I deserve congratulations, and never thought that I'd survive. If you tell me I won't make it, and that's when I super blue. Resilient little thing, just like mama raised you, so you got that wildfire in your soul. Don't you ever let it go, make it burn so bright that they all know. I deserve.
Please welcome to the stage Shannon Cohn from Below the Belt.
Hi, everyone. I'm going to adjust this for my... All right. Thank you so much for being here today for this absolutely vital conversation that we're going to have over the next hour plus a few minutes. My name is Shannon Cohn, and I'll be the moderator. And a bit about me, I am a documentary filmmaker, a lawyer, and a social impact producer. And I'm here today because, like our panelists, and I'm betting many of you, I'm excited by the infinite possibilities when diverse voices with unique perspectives and hard-earned wisdom have a place at the table where solutions are being created. That's when I feel like the universe sparks, and we all feel it. It's like this intangible feeling. We feel the universe supporting our missions, and we can tap into something truly change-making. My particular passion lies in utilizing story and its capacity to create empathy and propel action to tackle widespread systemic issues, something that we're doing with my current film, Below the Belt, which happens to be executive produced by Secretary Hillary Rodham Clinton, Senator Orrin Hatch, Rosario Dawson, and a few more. Below the Belt shines a light on women's health inequities through the lens of endometriosis. And over the past several months, we've really tackled a lot of the issues in a practical way. And some of those things, or some of the ways that we've done that is we've hosted public screenings across 6 continents with strategic partners like the World Economic Forum and the UNFPA. We've screened at dozens of medical schools around the world. And at the NIH's 27 institutes for over 20,000 employees. And miracle of miracles, we had a bipartisan event on Capitol Hill co-hosted by Senator Elizabeth Warren and Senator Mitt Romney on women's health for members of Congress, which is pretty exciting. And that screening led directly to the introduction a couple of months ago of a bipartisan Endometriosis Care Act calling for $250 million in increased research funding for the condition. So really looking at, thank you, yes. But really looking at practical solutions to these large-scale problems that seem insurmountable. But with the right partners, solutions, they kind of appear, and that's pretty magical. So that's what we're gonna be talking about today. And we'll get started. So the first panel is, I guess I'll get started with this trio of esteemed panelists that are going to delve into both research and innovation in relation to climate and health. First, Dr. Githinji Gitahi, the CEO of AMREF Health Africa. Gabrielle Fitzgerald, founder and CEO of the Panorama Group. Come on up when I call you. Yes, you have to come up here. And Dr. Rupa Basu, an environmental epidemiologist and climate research scientist. Thank you. It is a bright light. Thank you all for being here today. So Dr. Basu, I'm going to jump in directly with you, if you'll allow me. So your 14 plus years worth of research on this topic is incredible. In 2020 alone, you co-authored a review of 57 studies that found a significant association between air pollution and heat exposure with preterm birth and low birth weight. Can you tell us the top 3 highlights that why both the climate and reproductive health communities should be speaking to one another now more than ever?
Sure. Thanks so much for that question. And first, I'd like to thank the Clinton Foundation for the invitation to be here today. Really happy to be part of this very important and timely discussion. So the 3 highlights, if I had to think of 3 top ones, it would be consistency. So when we first published a study, there's a lot of skepticism. This is just one study. Now we've got 68 studies, 57 air pollution and 10 on heat, and found a consistent association between air pollution, namely fine particulate matter and ozone, and heat, and then adverse birth outcomes. And the adverse birth outcomes that were included were preterm delivery, low birth weight, and stillbirth. The second point, I think that was quite kind of expected but alarming to see the level of disparity. The disparity by race, ethnicity was also consistent. And some of these, for some of these health outcomes, it's getting worse. Even with more information and more studies, this is something that needs to clearly be addressed. The third thing I think is really important is that prior to this 2020 JAMA article, we had published all of our studies in environmental health or epidemiologic journals. I'm an epidemiologist, so that seemed to be the best fit. But this one was different in that my co-authors decided to publish this in JAMA, which opened this up to the medical community. It's really important to kind of bridge that gap, go across sectors, not just keep it in the scientific research audience, because we already know this is happening, and it's so important to kind of go past that. Because of this article, for the first time, they had a session on climate and pregnancy outcomes at the American College of Obstetricians and Gynecologists conference. So this is just one of the things that has happened as a result. So I think that's it.
That's incredible, thank you. And now there's a question for each of you. Gabrielle, I'll let you start. So as you know, we're at a critical moment when the world is somewhat paying attention to this intersection of climate change and health. But there are some gaps that we'd like to fill. So in your opinion, what has been informative so far, and how can we improve data collection and analysis at the local, national, and global levels to better understand the climate health nexus?
Thanks for the question. And let me just start with a bit of context and also thanking CGI for putting this on the agenda. I've been working in global health for a very long time, at least 25 years. And it really wasn't until about 8 years ago that the words climate and health were mentioned in the same sentence. And even then, it was hard to convince a lot of people that conversation needed to be happening. So it's really great that I feel like this week at UNGA, at CGI, there is now a lot of conversation on it. So to what research and data needs to be conducted at this point, we just heard from Dr. Basu, there is a ton of evidence already in place. And then still staying at sort of the macro level, if you just look at the stats on the natural disasters that are happening, 38 last year in the US alone, that cost over $1 billion. So we know from Dr. Basu the enormous impact that climate change is having on maternal and child health issues. We know from the data that these instances are happening more and more frequently. So I guess that my first answer is, I don't think we need that much more data. We know that the problem is here. Having said that, my organization, Panorama, is funding and partnering with several others to put together some data. We're working with a group called Y Labs that's currently putting together quantitative data to understand the impact on climate on sexual and reproductive health. And we're also working with a group in Tanzania called CAN Tanzania that's looking at the impact on coastal regions. And the impacts are not only of the type that we just discussed that are directing your health, but there's also a massive issue on access to health care, access to reproductive health supplies. If roads are washed out, if you're displaced from your home, you're not going to be able to get to the clinic to get what you need. So that's kind of I'll stop there, but there's a lot to say.
Thank you for that. And Dr. Gatahi, could you add to that?
Yeah, thank you, and thanks for having me here. I think I'll take a low-income country kind of approach to this question. The first thing I want to say is that health is the human face of climate change, and women are the face of health. So women are actually the human face of climate crisis. And using that framing, I would just say that the question around data, and I would follow exactly what you said, is that actually data is available. It's just not published. I think we have to make a distinction between that data relevance and the importance of data that is local, that's lived experiences. And I don't think we have a lot of that. We kind of tend to reflect on data as more what is published in peer-reviewed journals, and with a lot of respect for the researchers. For us, when we are working down there, you'll actually have data that is qualitative, community stories that tell you exactly what women are going through. And what we know from that qualitative data, even as we wait for quantitative data peer-reviewed and published, is that we know that the climate crisis is coming with new challenges, but mainly exacerbating existing vulnerabilities. Those existing vulnerabilities, from where I come from, we know that 70%, for example, of all maternal deaths are in sub-Saharan Africa, 7 out of 10. We know that a woman who's pregnant, her risk of death is 1 in 40 in sub-Saharan Africa. Compare that to about 1 in 11,000 in Europe. Now, that is coupled up with many other challenges of absence of water, absence of sanitation, energy poverty, gender norms, patriarchal societies. So when climate crisis is exacerbating these threats, it just makes the outcomes for women and young girls just worse. We see, for example, that the data we have is that gender-based violence is increasing. Why is it increasing? It is increasing because women have to travel further to look for water. Whereas they know they travel maybe 4 kilometers, now they're traveling further. What that means is that they are more exposed to gender-based violence, rape, and other things on the way by strangers, but also intimate violence when they get back home because they delayed house chores because of the gender norms that are there. We know that this is making it worse for girls and the risk of female genital mutilation. We know it's making it worse on early and forced child marriage. So climate crisis, we have the qualitative data, and I think what we need to do is to say, how do we capture these stories of individuals, even as we get global data on the number of women who maternal deaths related to climate crisis. We need to capture that data. And finally is to say that for us to do that, there needs to be investments in research. Right now, most of the investments in research for climate change and health are focused in the global north, and they are largely looking at heat stress, those things that, that would largely be on the global north side. When you come to the global south, there's heat stress, yes, but the vulnerabilities that exist are far much worse the impact of heat stress. So those things need to be studied. There need to be a shift of the research money to where the vulnerabilities are. But remember that we have a lot of qualitative community data that also needs to determine our actions.
Thank you. Dr. Vasu, I'm going to ask you a follow-up to that is an extension of this statement. So how can now, let's look forward, how can reproductive health, how can women's health be better integrated into climate action plans? And how can climate policies be more responsive to the health needs of girls and women?
Yeah, that's a great question. I think it's so important, as Dr. Gitahi mentioned, it's so important to look at this as a global issue. I'm more familiar with the US and American studies, particularly in California. And it's really time to take action. There's been so much research already on this, and I hear talk about identifying vulnerable subgroups, and I think we've identified a lot of vulnerable subgroups, and now it's time to take action and actually do something to prevent a lot of these adverse birth outcomes. So we know that they're preventable, that it's a known fact, it's just that we haven't really gotten there yet. So the first thing that we need to do, and I just mentioned this at the roundtable, so I see a couple familiar faces, and I think it's okay to repeat it because it's important, is that we need to think about local community levels and interventions and what we can do, and not to think about what will work in one area as a one-size-fits-all. Each area might be different just based on the populations, what is feasible, what resources that area has. A lot of the work that I've done previously has really focused on population-based large-scale studies, which I think are great for hypothesis generating. We didn't even know just 15 years ago that there was really a strong association between heat and adverse birth outcomes, for example. So of course we need to do these studies, but we need to, instead of repeating research, take action and really learn from these studies. Some of the things that can be done are just common sense, but the first thing that we need to think about is that when we're looking at heat advisories, pregnant people are often not even included. So if they're not included, they don't know that they're at high risk. When you don't know that you're at high risk, you don't take any precautions. I can think of my own pregnancies, and I thought, wow, I'm really not able to control or regulate my body temperature. Thought it was just me, and this is how I got the idea to do this research. And I realized that, well, we have now, thousands of cases where this is occurring. This is not just an individual phenomenon anymore, and we need to do something about this. It's completely, largely preventable.
Thank you. And Gabrielle, I would love to hear your perspective on how we can better integrate health into climate action policies.
Yeah, well, first of all, just starting with this statistic, that of the $70 billion that's been committed to climate financing, only less than 2% of it is committed to health. So that means significantly less than that is going to women's health, reproductive health issues. So there's an available pot of money that needs to be utilized. That's one thing. Secondly, women need to be at the table for the development of climate action plans. And I mentioned earlier our partner Y Labs, they did an analysis of 58 countries' national adaptation plans and found exactly 0 included all aspects of sexual and reproductive health in their action plans. So there's a lot of just baseline work to do. And I think I will just mention, beyond just specific reproductive health issues, we need to be thinking about the broad spectrum of health issues. Climate change is leading to an increase in malaria, which is pregnant women are particularly vulnerable for. There's an increase in dengue, and so where we've had a challenge of getting vaccines and medicines distributed before, it's exacerbated by both the number of people that need them are increasing and the potential challenges of access are increasing. So there's a lot of work to be done.
Dr. Gatahi.
So in addition to what my colleagues have said, I think we just need to be human. We need to wear a human heart. I think the climate crisis has been complicated and become a very technical issue. And I think the more we wear a human heart and we actually say we want visibility of the individuals who are vulnerable, that visibility means that we need to make this community-led and people-centric. And therefore, we must actually think about those vulnerabilities. I think right now, we have attempted to make, as AMREF, we worked with African ministries of health and COP29 and others to try and make sure that we add the human face to the conversation. And how did we do that? We tried to get ministries of health to get on the table for COP. And you'll be surprised, Shannon, that the first time we tried this in Egypt, COP28, we tried to get ministers of health to the COP. And all of us told them, our presidents cannot give us permission to travel. That's not a health conference. That's a climate and energy conference. And you can imagine the impact of all these changes is actually human life. But the ministries of health that are actually in charge of making sure you have policies that are reflective of the issues we are talking about here are not on the table there. But we made progress. When we went to Dubai for the COP29, we had more than 100 ministers of health. We had mobilized an Africa common position on climate change and health, and we took it there. And actually the COP28 did a health declaration and a health day. And we are hoping that when we go to Azerbaijan, this is going to be taken forward. So we need to add a human heart to the climate side because it's truly the human face. But most importantly is that we must then start to look to make visible the individuals themselves, even as we collect data. We must make sure that these individuals appear in the nationally determined contributions that countries are doing, because that's national policy. This is what we will do about the climate crisis. If what we will do does not include health of mothers and young people and young girls, then what are we doing exactly if we are discussing, if Africa contributes less than 3% of global emissions, for example, and most of the NDCs are talking about renewable energy, they're talking about how they're going to plant more trees, they're talking about reduction of, those are extremely important, but they must add the more important layer of what are we doing about the current crisis of exacerbating vulnerabilities that our people are facing that do not have a 96% discount because our contribution is only 4%. If that human side is left out of the NDCs, then the NDCs are not reflective of the communities for whom they're being prepared. So this is really what we need to focus on. Yeah.
Thank you so much. So we have just a few minutes left, and I know it goes so quickly. In a few words, you have this captive audience. I'd like for each of you, starting with you, Dr. Basu, to tell them why they should care about this beyond the obvious, but why they should care about it, and share one practical thing that each person in this room can do today.
Okay. I think we've come a long way in terms of research. I started this research over 20 years ago, and I think that we started to think of heat being related to people over 65, maybe those with cardiovascular respiratory diseases, and then we kind of worked our way to other vulnerable subgroups. And it didn't come until recently, I said just less than 15 years ago, that we thought about pregnancies as being adverse birth outcomes as being a high-risk group. I think that's so important because now we have so much data. I've said this before, we have so much data, but why does it take so long to implement policy? Yes, there are some policies starting. California has SB 65, which is our momnibus for pregnancy specifically, and trying to address the disparities that I was talking about. So that is really important. But I do think that this conversation about women and children being affected by climate is so important. We're often the last to get studied and need the most data to support relationships. And I don't understand that, because when you're talking about vulnerability, you can't get more vulnerable than people who are pregnant. So I think this is one thing that we really need to think about. In terms of an action point, again, I think we know about this in the scientific community, we know about this in the medical community, to get this message out there, because I think the first thing is public health messaging and health education before we can even take any kind of action. So thank you.
So I would say the reason you should care is completely selfish. This is going to impact all of you. And if you're not a woman, your wives, your mothers, your daughters. So I live in Seattle. When I moved there, it's still a great place to live, but we didn't have forest fires every summer. And now we have forest fires and have to totally change our behavior for about a month of the year to respond to the make sure we're not inhaling smoke. So I would say this is one issue that is not far away. It is something that is coming very soon to a community near you. And in terms of something practical you can do, because of what I just said, climate and the impacts of climate on health and women's health in particular really needs to be integrated into whatever issue you're passionate about. It can't really be disaggregated at this point. It is central to all the things that we collectively care about.
Yeah, and what I would say is that this is probably the single biggest threat to our health, to the health of the world and the populations of the world. So we must, as we say, it's selfish. It's actually about us. It's also a rights issue. A rights issue. I don't know how many of you have read the document from the Summit of the Future. It could not complete sexual reproductive health and rights. It says sexual reproductive health. So it's a rights issue for the people we're talking about. So we must care about it because it's a rights issue. And what can you do? Support solutions by local communities. We must always remember that in the midst of all these global conversations, when there's a climate crisis in a small village in Malawi, the communities themselves have solutions for that day and tomorrow. They go out and save the pregnant mother. They move them to safe houses. They actually do something. Let us actually support and advocate for support of local community solutions, because where resilience, that's where resilience belongs. And as I close, I'll just say, recently we worked with technology companies and developed a tool for tracking girls in crisis, meaning that you know when the girls are in crisis, and these are girls and young women, and if there's a crisis, you'll call them a mobile phone that's owned by a community health worker, and that community health worker can check on them every 3 months, and they can say, where are they? If there was a water scarcity problem, and maybe they had GBV, where are they over time? And therefore you can actually create interventions by creating visibility for those who are most vulnerable. So support local solutions. It's a rights issue, and it's about you and I.
Thank you. And on that note, yes, please thank our panelists. And thank you. And I don't actually need 3 mics. Now we're going to hear from some of our commitment makers. This is my favorite part. I love hearing about these incredible, inspiring people. And we have several very powerful examples of how our partnerships are working on a practical level. CGI commitments to action are specific, measurable plans for addressing global challenges. And just a little bit of background, each commitment to action typically includes 4 things: a clear objective, so a well-defined problem or challenge to be addressed, measurable impact, so that's concrete goals and a timeline for achieving them, partnerships, collaboration between multiple organizations or sectors, funding and resources, something we all know a little bit about, a plan for securing necessary financial and human resources. So let's hear from one of our incredible CTA makers. First, please welcome Christine Squires. She is president and CEO of AmeriCares Foundation.
Thank you. Again, hello, I'm Christine Squires. I'm the CEO of AmeriCares. At AmeriCares, we help communities prepare for, respond to, and recover from emergencies to protect health. And one of the biggest emergencies of our time is the climate crisis. 2 years ago, AmeriCares and Harvard Chan Sea Change made a CGI commitment together to expand and adapt our U.S. climate resilience toolkit to 3 to 5 additional countries. This climate toolkit is the first of its kind, and what it does, it includes guidance and emergency planning to help clinics reach communities in times of disaster like hurricanes, flooding, wildfires, and extreme heat. So today, I'm here to share and proud to share that it's working. We've made considerable progress thanks to the generous support of our partner, Johnson & Johnson. We're now expanding this U.S. climate toolkit across the globe, and we're kicking it off in the Philippines. We've been rolling up our sleeves and getting to work with local healthcare providers, academic experts, and the Department of Health so we can make sure we adapt this to the Filipino context, taking in the unique challenges and opportunities there. Our climate toolkit also includes guidance for pregnant people who, as you just heard, are often most at risk. We know extreme heat is linked to preterm births and low birth weight and other pregnancy complications. So with that, I'm very excited to announce that our climate toolkit will be ready to pilot by May 2025 in the Philippines, just in time for their peak heat season. In fact, I was just in the Philippines this past May, where a dangerous heat wave shut down schools. It was over 114 degrees Fahrenheit. Now imagine how oppressive that would feel to an expectant mother who's eating for 2, who's carrying the weight of 2, and who's trying to cool for 2. We know our approach works. We know that healthcare providers find this resource incredibly helpful, and we also know that it's in high demand. So I'm going to share some of that with you. We've shared this kit with 1,000 partner clinics across the US, and the tip guides and resource guides have been downloaded 20,000 times. So with additional funding partners, we're looking to expand this to additional countries, starting with Puerto Rico, Colombia, Tanzania, and India. At AmeriCares, one of our core values is partnership, because we know we cannot do this work alone. It takes all of us. So today, we need your partnership to accelerate something we know is working, and we know that it's needed. So today, I ask you, all potential partners, to please join us in this commitment to health and building climate resilience, because I know together we can make a difference. So let's get to work. Thank you.
Thank you, Christine. Now please welcome Dr. Carol Sakimpi. She is Senior Director for Africa at MSI Reproductive Choices, and Sharon Young, Director of Partnerships at Blue Ventures.
For women living in the communities at the front line of the climate crisis, the link between climate justice and reproductive rights could not be clearer. Climate change is not a distant threat. It is their daily reality.
When drought hits, women and girls need to walk further to find water. When harvest fails, they struggle to feed their children. When their homes, damaged by flooding, becomes unlivable, they and their families are displaced. In coastal communities, women and girls are threatened every year by the climate crisis. Overfishing and habitat degradation are collapsing fisheries, placing these communities at risk of food scarcity and lost livelihoods.
Extreme temperatures and weather events also affect access to health care, including health systems infrastructure and supplies, and contribute to poor maternal health outcomes. When roads are flooded, health posts are damaged, and commodities cannot be transported, access to care is significantly impacted. 1.4 million women are at risk of losing access to contraception over the next decade due to climate-related disruptions. This could cause an additional 6.2 million unintended pregnancies, 2.1 million unsafe abortions, and 5,800 pregnancy-related deaths.
In climate-affected coastal communities, the choice to access contraception can be the difference between life and death and giving a woman back her agency when everything else has been taken away from her. Restoring marine ecosystems and fisheries will no doubt help these women to live a better life.
Good afternoon. I am Carol Sechimpi, Senior Africa Director for MSI Reproductive Choices, a global leader in the provision of abortion and contraception working across 36 countries.
And I am Sharon Young, Chief Partnership Officer at Blue Ventures Conservation. And today, we are thrilled to be announcing our Clinton Global Initiative Commitment to Action.
MSI and Blue Ventures have been working together in Madagascar for 17 years. We have one of the longest running, most successful integrated health and environment programs in the world. Now, we have identified coastal communities in Senegal, Tanzania, and Kenya that need support to adapt and build resilience in the face of the climate crisis.
We have committed to raising $15 million to expand our programs in 3 communities in these regions. And we would like for you to join us. Together, we will expand access to our comprehensive sexual and reproductive health care alongside our community-based fisheries management and marine conservation initiatives to strengthen community resilience.
We hope you will join us. Together, we can support communities to take back control for the health and the future of the people and the planet. Thank you.
Thank you.
Thank you both. I'd like to now introduce Blandine Umuzinraninji, who was part of the CGI Greenhouse cohort. And a few words about it, if you're not familiar with it. CGI Greenhouse supports entrepreneurs from growth stage social impact companies from across the globe, working to accelerate and scale their innovative technologies and business models that aim to solve critical global challenges. Enterprises recognized by CGI Greenhouse are examples of what's working around the world to build a more equitable and resilient future for all. Blandine?
Hello, everyone. When you hear Cosmotive, think about a solution that's working to promote menstrual freedom for girls and women in Africa. My name is Blandine Umuzinraninji. I'm the founder and CEO of Cosmotive, a social enterprise that I founded in 2014 to improve reproductive, maternal, and child health in Rwanda and throughout Africa. Our goals include the provision of access to menstrual, maternal, and child health information and self-care products, as well as sensitizing about breaking the stigma around menstruation to ensure that no one is held back because they menstruate. Through Cosmos Magazine, Cosmo Health app and helpline, empowering parents and girls through Cosmo Wearables, which are collections of maternity and nursing wear that we make for empowering parents and enabling breastfeeding, as well as manufacturing and distributing Cosmo pads, which are usable sanitary pads that we make for investing in girls' education, women's health, and the planet, one pad at a time. Cosmotive promotes feminine freedom despite the flaw. We strive to end period poverty since about 2 million girls and women in Rwanda miss school or work because they can't afford to buy menstrual products. This amount to a potential GDP loss of $215 per woman every year in our country. This same issue of period poverty affects 1 out of 4 girls and women in sub-Saharan Africa, or 128 million girls who miss school each year due to period poverty. Even those who can access period products only have access to poor quality pads that are bad for the environment, because 1 disposable pad is polluting the planet as much as 4 plastic bags. We manufacture Cosmo pads, which are eco-friendly, cost-effective, usable sanitary pads that last for 2 years to provide underprivileged girls the ability to stay in school the whole year without missing classes during their periods, and for saving the planet from the effects of disposable pads as we improve women's health, and for young women and girls working in our factory to not only discuss their challenges about menstruation, but also learn how to be part of the solution. As girls and women break the silence about menstruation and benefit financially from making and selling pads, they come to see their periods as a source of pride and power. Since 2022, we've gone from reaching 50,000 girls to reaching 300,000 girls with our Cosmo Pads dignity kit, which prevented the use of 150 million disposable pads, which is equivalent to the pollution from 600 million plastic bags, or 3,600 tons of plastic. We still need to make 10 times our current impact to close the gap of period poverty in Rwanda, and about 100 times to make it across Africa. The more you join us in investing in girls' education, women's health, and the planet, the sooner we can close this gap together, 1 pad at a time. Thank you.
Thank you, Blendine. Now we're going to move on to our second panel of the session, which will explore the funding and partnership models that support efforts to mitigate climate change and health. I'm going to call these esteemed panelists up to the stage. First, we have Dr. Carly Silver. She's the CEO of Grand Challenges. Jeff Jacobs is the Director of Product Innovation and Market Access at Merck. And Dr. Pei Yao Chen, President and CEO of the Global Fund for Women. Hello, everyone. Thank you for being here. We're going to jump right in. So this is a question for all of you, actually. And so as we heard in our first panel, the intersection between climate change and reproductive health is gaining attention, but still, communication and collaboration between the two fields is still evolving, and a lot of times they operate in siloed efforts. So whereas climate change has been a major focus for global financing, especially through multilateral and philanthropic sources, most of this funding has traditionally gone toward mitigation, like reducing carbon emissions. And reproductive health has historically been funded through global health initiatives, development, philanthropy, often with a focus on family planning, maternal health, and gender equality. So, understanding this is the landscape we're dealing with today, what's working with the current funding models we have now, and what funding models do we need to bridge that gap? So you're sitting closest to me, Dr. Chen, so let's start with you.
Thank you. I'm really glad to be here. So I think one key factor contributing to the siloed funding model between climate change and reproductive health is the lack of gender analysis to address the impact of climate change. And we heard from the last panel that about vulnerabilities. And historically, women and girls have experienced systemic inequalities that are rooted in legal systems and social norms that assign them to distinct roles in their communities around the world. And these existing inequalities make them particularly vulnerable to climate risks. One critical effect of this risk is their ability to fully exercise their sexual and reproductive health rights, which is the freedom to decide what's best for her bodies. And we heard about examples when during natural disasters such as flood, storms, and heat waves or hurricanes, the healthcare system and transportation is usually not working, and that women and girls lose it really makes it difficult for women and girls to access clinics, hospitals that provide family planning services, abortion services, and really life-saving care during pregnancy and during childbirth. One more example would be the climate change really displaced millions of people per year, and forcing women and girls to live in temporary or informal settlements. And these conditions usually lack adequate services to meet their reproductive needs. I think it's also important to recognize that women, girls, and marginalized communities are not just victims of climate change. Many of them are leading and creating solutions in their community to address climate change issues. And their approach focuses on individuals and communities in a holistic way, because people do not experience climate change or reproductive health issues in isolation. And their approach have the potential to catalyze transformative change, but they remain unrecognized, undervalued, and under-resourced. So I think we need a funding model that really recognizes their contribution and their leadership, and providing more support to the community level, to the grassroots level.
Thank you. Jeff?
So as a representative of the private sector, I thank you for the opportunity to speak with you. So this question for me really speaks to the need for funders and governments to truly prioritize products that have a dual purpose of addressing health as well as adapting to climate change. Our shared challenge is to make this data that we've been talking about, that climate does impact health, really a priority, and seeing it actionable on the ground. And that means healthcare system changes for the patient as well as for products that serve those patients. And for me, what is needed is really that vision. Yes, funding is always needed, but really that vision of making that interconnection. There are products today that are heat stable, heat resilient, that have shown themselves to be just as effective as current products, that can support those climate resiliency needs that still are not being uptaken like they could be. And that just, I guess, speaks a little bit to that real, true prioritization. My organization, Merck for Mothers, has supported one of those heat-stable products, no commercial interest at all in the product. We've been supporting it for a long time to make it available. We've done lots of work to make it available, affordable, etc. The manufacturer has agreed to that, and still we're somewhat challenged on moving it forward. Nevertheless, there are some funding models, so ours in partnership with the World Health Organization to advance this product. The Unitaid and the Bill and Melinda Gates Foundation are now taking on some of that work to advance it. I guess what I would say is, somebody like the Global Fund, who's at that intersection of maternal health, reproductive health, and traditional finance, I do believe could do more in the space. But at the end of the day, when we think about investments in health and health systems, we need to come together with how do we improve health outcomes, how do we think about climate resiliency, and of course, how do we think about health equity?
Thank you. Dr. Silver?
Thank you. Pleasure to be here. So I'll kind of add my voice into here as an innovation funder. And one of the key lenses that Grand Challenges Canada was founded on, one of the beliefs, is that to find innovation that's going to be scalable, sustainable, and impactful in the long term to some of these biggest challenges, we need to fund local innovators. So we've done that for almost 15 years now. Our pipeline is about 2/3 from innovators in low and middle income countries. And I think that's a thing we need to back into even more in this concept of climate and health. We heard in the previous panel about how much climate is a localized, the climate change phenomenons are very localized. And we saw this with a call that we put out a couple of years ago, got over 800 applications from 80 different countries. And it was really interesting to see the trends where South Asia might be more talking about the flooding that they see and what responses you would do around that. West Africa was more around infectious disease spread. East Africa was more around the food insecurity. And so our likelihood of finding global solutions is very low. So I think maybe except for yours, I would say. There's always exceptions to the rule, but I think being able to back local is really important. And our belief is now backed by data. We've done an analysis on our pipeline and things that we've supported to transition to scale. And we find that things that are locally led are more likely to be scalable and sustainable. So we're following the impact, and I would say fund more local. So,
thank you. Which is a perfect segue into my next question. Basically, what are some of the innovative projects or solutions that your organization is doing now, and maybe share some of the challenges, the practical challenges you may be encountering?
I'm excited to share some examples. So Global Fund for Women has been supporting grassroots women-led organizations and movements to tackle the impact of climate change. And one example is in the Pacific, our partner, the Pacific Island Feminist Alliance for Climate Justice, is developing women-led disaster response systems, really prioritizing local knowledge and resilience. So they train women to lead early warning systems and disaster preparedness, and really ensuring that community voices are at the forefront of disaster response. In Uganda, our partner, Girls for Climate Action, they are empowering young women to be through activism and education, linking climate change, climate justice, and reproductive health rights. So they are working with communities to develop community-led solutions that meet the specific needs of their communities. Some examples would be they use local materials to create energy-saving stoves. They use traditional knowledge to build bio-intensive gardens using organic pesticides and fertilizers. So these are just some examples of local innovation. And it's really important that funding reach these type of grassroots organizations. They have the solution, they know what to do, they know how to create change. What they need is resources and to do what they know what best to do.
Thank you.
So my team at Merck for Mothers has been providing long-term catalytic funding toward the adoption and scaling of a medicine to prevent the #1 cause, the direct cause of maternal death, postpartum hemorrhage, or bleeding after birth. The medicine is called carbetocin, that is now heat-stable version of carbetocin. And other large funders have now started to come in and take on the catalytic work that we've done, from evidence generation to supporting normative policy change to now adaptation and adoption at country level to further that advancement. Obviously, we need to think about, it's not just one medicine. One medicine enters into a healthcare system, and so how do we ensure that it's adopted safely, effectively, et cetera? But the medicine itself is heat resilient, which is clearly adapting to what we need here, health and climate change. And so we do think that it's a product that is warranted, WHO has adopted, and the UN Commission of Life-Saving Commissions has called for years ago because of an issue of quality. And when we think about equity, we want to make sure women get good quality care, and that includes the medicines that they have.
Thank you. I love talking about solutions. I think, especially in this climate and health space, like climate change is such a huge issue. The challenges still existing in health, such a huge issue. Put them together doesn't make the issue smaller. And I think I've heard a lot in the last few years about the problems around it. So I'm really excited when we get to talk about solutions. And most of the time, I think it's because there actually are ways forward here. And it's not that we are starting from scratch. There are things that people are already doing, as we've heard, that can be built on. There's also like really strong foundations out there that have been laid based on other technologies in the past. So when I think about some of the effects of climate change, it exists, and I think it was even referred to earlier today, that idea of disrupting how people would get to health facilities to seek care, that kind of in-person element of the healthcare system. COVID helped us already adapt. We've got a lot more digital tools that are online that can help us think about what decentralized healthcare systems look like, that end up being much more in people's hands or pockets or wherever they keep their phone. And this is true in many, many countries around the world. So I think this is a really strong foundation to go on. The second thing I would say is that, as we've heard, humans are adaptable people or creatures, and they're not waiting for kind of a global agenda or even funders or anything to set an agenda in order to be acting and adapting in this way. We've funded over 1,500 innovations over the last 15 years, and guess what? Those problem solvers are still solving the problems that they're seeing in front of them. Many of those problems have links to climate change. So one of the first places we've gone is looking at our existing solutions and who's really building on that work in order to address the climate change problems. So two concrete ones that I'll give you that really talk about these decentralized healthcare systems that could be adapted. One is a Kenya-based company called Jacaranda Health. They've been developing and scaling an AI-based digital platform that prompts pregnant women to seek care at specific times when they have really high-risk symptoms, or to answer kind of basic questions. But they can triage which women are needing care, which women need more attention. It's been deployed to over 2 million people in 3 different countries already: Kenya, Eswatini, and Ghana. And this prompts, which is the platform, helps moms know when they need to actually seek care, and can connect them with that care. They're now actively layering on climate data, so weather data in localized areas, on top of the data that exists for the pregnant women. And so they're learning about how they can be actually sending out prompts so that women who are expectant, who are experiencing kind of the adverse events of heat and other climate-related disasters, can respond, can know that there are things they can do to lower their risk factors. So that's one. The second is more on the gender equality front. We've supported a fabulous enterprise called Sahat Kahani, led by 2 Pakistani women. Their real challenge, it's a telemedicine approach. So same idea, clients can phone in on the phone, get support to doctors. But the real thing that they're solving for is the health resourcing issue that many countries face. They tapped into a resource that currently sits at home in Pakistan. It's a whole cadre of women who go through medical school in order to get really good marriages, but then are expected to stay at home. They've just revamped what a doctor's kind of work environment could be. It could be that they're sitting at home doing this, and they've now deployed 7,500 lady doctors, they call them, into the Pakistan system. And this group of women are now serving the needs of clients in really hard to reach and displaced populations in Pakistan. So a couple things that can be adapted, and you could see real utility around the climate stuff. So
Incredible. Thank you. Dr. Chen, following that line of thinking, I would love to know, in your opinion, what do we need more of? Like, what do we need, resources for? What do we need to be funding and partnering on to find real solutions for girls and women?
We need more funding for grassroots organizations and movements who are leading the change in their communities. And in recent years, we have heard a lot of localization, excitement, and talks about the importance of localization. But to this day, only 0.2% of climate financing goes to women-led climate actions. So why the gap? Why the gap between the excitement and commitment and the reality? And I've heard several reasons, and they usually fall into these categories. The first one is, well, these organizations, their current budget is so small, they don't have the ability to absorb and manage larger gifts effectively. This is a myth that continue to perpetuate the under-resourcing of grassroots organizations. And in my organization, Global Fund for Women's almost 40 years grant-making history, we learn and distributing money to more than 5,000 organizations in 179 countries, we have learned that an organization's current budget size is not a reliable predictor to their ability to manage larger grants. It is their organizational leadership, their organizational culture, their connection to the communities and the broader movement that matter. The second reason I've often heard is that grassroots organizations and movements are risky because they cannot meet the requirements of due diligence and risk assessment and capacity assessment. And I think when it comes to risk, funders and philanthropy often think about fiduciary and reputation risks. And this leads to really complicated application process, risk management process, and a capacity assessment that only large organizations with the staff and resources can navigate. So we need to broaden our concept, and we need to rethink the whole concept of risk. We need to consider risk for not providing timely response to community needs, the risk for implementing something that continue to create silos in the community, the risk for for investing in a solution that's not contributing to long-term sustainability and resilience of a community. And the third one, thank you. And the third reason, and this is the last reason, the third reason that I've heard a lot is grassroots effort cannot scale. Again, there's a really, in the context of climate change, the concept of scale is really related to quantity, that implement something that can reach many people really quickly. I think we need to move beyond this narrow focus on quantity, but really look at depth. So it's really about implementing, it's really about addressing multiple issues at once, from a holistic perspective, because this is people's lived realities. They don't live in siloed issues. It is about ensuring that the solution is being adopted and sustained through community participation, leadership, and collective ownership. And it's also about building collective power so that community members can transform the systemic inequalities that face women and girls in marginalized communities.
Thank you. Thank you to our esteemed panelists. All right, thank you very much. So we are now going to turn to the last part of the session, an exciting commitment to cut greenhouse gas emissions in hospitals and enhance healthcare climate resilience. And to share this commitment to protect people and planet, I would like to introduce Her Excellency Razan Al Mubarak, the UN Climate Change High-Level Champion for COP28, leading the Race to Zero and Race to Resilient campaigns, and Diana Picon-Magnari, the International Climate Director of Healthcare Without Harm.
We're attached. We're attached. Okay, forever. Thank you very much, Shannon, and thank you to the Clinton Global Initiative. Ladies and gentlemen, the nexus between health and climate was strongly recognized by the parties at COP28. And this recognition would not have been possible without the incredible leadership of allies like Healthcare Without Harm. Alongside my co-champion and great friend, Nigar, from COP29, we are leading the Race to Zero campaign. The Race to Zero campaign is the world's largest campaign of real economy leaders taking action towards net zero to help halve emissions by 2030. And since its launch, I'm proud to say that the membership has doubled to 14,500 actors across 146 countries, including companies, financial institutions, cities, universities. And thanks to the commitment of Healthcare Without Harm, many of them are healthcare facilities.
Thank you, Razan. Healthcare Without Harm is an international NGO working at the intersection of climate change and health. The health sector is responsible for nearly 5% of global greenhouse gas emissions. That is why we are collaborating with the World Health Organization to support 84 health ministries that have committed to low-carbon, climate-resilient healthcare. Healthcare Without Harm has also worked with Race to Zero to mobilize more than 70 non-state actors. These are healthcare institutions representing thousands of health facilities from around the world. These are leaders who are turning commitment into action. But while progress is happening, we need to move faster. We are announcing a Clinton Global Initiative commitment to action to first, double the number of healthcare institutions committed to net zero emissions through the Race to Zero.
Thank you, and we are so thrilled to see the commitment and leadership of Healthcare Without Harm and the institutions that you work with. At the same time, the world's health facilities are on the front lines of the climate crisis. They also play a critical role to enhance resilience and provide equitable care to the communities that they serve. Under the Race to the Resilience campaign, we are working with many, many partners who are already taking action to enhance the resilience of 2 billion people across 164 countries. I know that many of the institutions that you are working with are also enhancing the adaptation and resilience of the people that they serve. And that is why today I would like to invite Healthcare Without Harm to also work with us under the Race to Resilience campaign to recognize and strengthen the contribution of all your members to enhance resilience.
We are so honored to work in collaboration with you and the Race to Resilience as well. Indeed, the second part of our commitment today, with your help, is to build healthcare climate resilience to safeguard the health of over 100 million patients served by our members. This means enhancing the ability of our hospital and health system members to adapt to the climate crisis while embracing climate mitigation and sustainability.
Ladies and gentlemen, as the high-level champion for COP28, I know inextricably and authentically that the health of people and the health of our planet are inextricably linked. Today's commitment is about protecting our hospitals. Today's commitment is about protecting our doctors. Today's commitment is about protecting our nurses and families. Our commitment will require dedication. Our commitment will require collaboration and resourcing. And we invite all of you to support Healthcare Without Harm in mobilizing climate action through our Race to Zero and Race to Resilience campaign. Please do help us achieve this incredible vision of healthy people on a healthy planet. Thank you very much.
Thank you. Thank you so much.
All the papers.
Thank you both. It's so exciting. So this concludes our session. Thank you to our esteemed panelists and our change makers for sharing their time, their work, and their wisdom, and to all of you for being here. Our next session will start in about 15 minutes. Thank you.
This session has now concluded. Please make your way to breakout sessions starting at 3 p.m.